Hi, I'm Courtney and I'm back again to talk about endo shock. So today I'm going to talk about what endometriosis is and what symptoms to look out for. I'm going to pop by here a little picture that proves endo has actually been looked into as top 20 painful conditions alongside a heart attack. So anyone that just says it's a painful period, read it and weep. It's not. I'm getting all sassy today. So I'm just going to pop a picture by here as well to describe to show you sort of how endo works. Most of the information from this video will be from this book, which is the Endometriosis UK book, and it says The Expert's Guide to Treat, Manage and Live Well with Your Symptoms. So a friend got me this just after my laparoscopy. Thanks, Dan, if you're watching. It's very helpful. It's been fab. I haven't read it all yet, but for so far and for this video, it's been amazing because everyone asks me after my surgery, like, oh, what actually is endo? And to give a quick answer, I couldn't describe it properly. So this has been really helpful for that, and hopefully this video will be helpful for that too. So I'm just going to read the definition from the book, so I'm getting it perfect of what they've put. Obviously things like with research do change quite a lot. This book was written in 2018, I want to say it was. So obviously things have probably changed from then. But yeah, 2018. So things could have changed from then because more research is going into it hopefully now. But yeah, so their definition, not diagnosis, their definition is endometriosis is a gynecological disease, which means it's related to the female reproductive system, where cells similar but not the same as those that line the uterus or the womb, I can't talk today, grow in other places. These are usually growing in the pelvis, but on occasion can grow elsewhere in the body. These abnormal tissues respond to hormones and are thought to bleed on a monthly basis. Now that I have actually looked into, because some people say they don't bleed, but I think the reason they put it in those little quotes is because it doesn't bleed like a period, but it's sort of, I think the hormones grow the endo each month, so it makes it spread, not quite bleed, but that's how they describe it to make it more visual, I think. So then the bleeding of like the hormones, the lesions, cause symptoms such as pain, which result in scar tissue. So the scar tissue, the endo, can be scar tissue, nodules, implants, lesions. It can be called so many different things. There is also something called Endometrioma, which is cysts that grow on your ovaries, so endo on your ovaries, which is normally cysts. They do something called a chocolate cyst, which ruins chocolate for me, I've got to be honest. Whenever I see like an actual picture of it, it is quite gross. I won't show any pictures like that on here because I don't know what's allowed, but I will show some sort of cartoony safe ones just to describe what I'm saying and give you a bit more of a visual to understand it. But yeah, they call chocolate cysts because there's like basically just full of blood and it's like dark blood. It's grim, I know, sorry. There's something also called adhesions, which are thick bands of scar tissue that combine organs together. You might have heard me say that word in my first video because I did have quite a few adhesions. My appendix had adhesions coming off it and were stuck together, but the adhesions were sticking my, oh god, appendix to my abdomen wall, as was the adhesions on my bowel sticking from my bowel to my abdominal wall as well. But the adhesions are different from implants. I'm going to show a picture as well that explains that. So the adhesions are more, I explain it like an elastic band, is like string almost that like sticks to things, and the implants are more, it looks like blood on the wherever it's growing really. They do respond, well, the implants respond to the hormones, but the adhesions is more a reaction from scar tissue and impact. I think from what I can gather, that's what they're trying to say. Obviously, I'm saying I think a lot, it's probably not filling you with confidence, but obviously I'm not medically minded at all. I was doing teacher training, so I'm just learning as I go along, and I'm reading from the books. I am doing my best to research everything, but obviously I am still not medically minded. But this is what the book's saying, so I'm just going along with that, hoping for the best. So I'm going to put up a picture here that shows some of the symptoms of endo. There are more that are not always listed, like me and my friends have quite a few symptoms that we haven't seen listed anywhere. So I'm going to read them off as well, just to keep an eye out for those sorts of things, because they are linked to endo. So you ready for this list? Because it is a big one. So the main one is painful and heavy periods, as well as pelvic pain from all times of the month that interferes with your everyday life, as well as pain during intercourse. Bowel symptoms include diarrhea, constipation, painful bowel movements, and me and my friends also do get blood with bowel movements quite a lot. That could be due to having endo on our bowel. I'm not sure if it's a symptom that you have if you don't have endo on your bowel. Obviously you do still have the bowel symptoms regardless of where your endo is, but I'm not too sure about the blood. Lots of bladder symptoms, so you can have pain when you're urinating, urgency to go, like in the middle of the night I'll wake up with a horrendous pain that I need to like rush and go to the loo, and that pain will linger for a while but then it will settle down, so that's just like an urgency to go. And there's kids outside ruining my vibes, it's fine. A massive one as well is fatigue. Oh my goodness. So when you're in pain you can't sleep, just simple, it's really annoying, but there we go. And then some days you'll sleep all night, wake up, sleep all day because you're so tired, you just constantly sleep. And then the next one is one I suffer with quite a lot, but I don't know if everyone does, like my one friend doesn't, so I don't know if it changes or what. This one's brain fog. Now I might do another whole video on this because it's not fun. As you can tell probably from these videos, I get very, oh my god, what on earth was I gonna say? My brain just, it's like disappears. I'll start talking and it's just nothing there all of a sudden. Obviously I am on a lot of painkillers at the moment because I still have just had my surgery 2 weeks ago on Tuesday that I'm filming this. So yeah, I am still on quite a lot of painkillers and that can make the brain fog worse. But even before my surgery, there was days I wouldn't take painkillers and the brain fog would be real. Like I'll be talking to my mum and I'll just be in a world of my own and she'll just be like, God, what are you on about? So yeah, but that is obviously made worse by the painkillers. Bloated belly, which is also known as an endo belly, which is quite cruel because it makes you look like you could be like 6 months pregnant, which is horrible because a lot of girls suffer with catching and getting pregnant, but yet you look it all the time and it's horrendous, and it can be so heavy and painful and it just goes like, it's ridiculous. I have read into this before. It's sort of like a reaction your body has if, like, so obviously you're having the pain and your body sort of bloats out to protect it or something. It's science, I don't know, but that's just sort of what that does. Another fun one is mood swings. That can be quite hard. Obviously you have that with your period, but you do have quite bad mood swings with endo as well. And associated with that, I had to have Prostap injections, which puts you into a chemical menopause. So obviously I was already having mood swings with endo, and then the menopause as well, mood swings. Feel sorry for my family is all I'm going to say. Another really hard one is infertility and difficulty conceiving. This is different for everyone because obviously everyone's endo is different. Also it depends on things like the shape of your womb, if you've got like an abnormal womb, how your ovaries are. They can do a test in your operation, which I actually had in mine. They do a dye test to see how your fallopian tubes are. So mine were good, so that's something exciting, I suppose. But I have also got PCOS as well, so that's another issue that I could have when I'm trying to conceive when that time comes. But it's one of those ones, it's quite hard because I've got a friend going through it at the moment and they can't really do anything until you start trying, and even then they're not very helpful. So yeah, that's another hard one. So next picture I'm going to prep is quite a lot, so I'm going to read through it. I've got it ready on here because it is a lot. So this sort of describes the cycle pain, so I'm assuming that is additional pains you can have with endo when you're due on your cycle. So overall pains in the top corner, we have PMS, breast pain, migraines. Oh yeah, I haven't actually mentioned that one. Now migraines, you can get them all the time, and my doctor had also said that even though he could remove all the endo, he could never stop the migraines. So that's fun because I currently have one today. Feel absolutely sick, can't be honest. And that's something they can never really help. They have tried me on antidepressants that's meant to help migraines, doesn't. So yeah, I just gotta take painkillers and hope for the best, and sleep, which I am gonna do after this video. Brain fog, which I mentioned, mood swings, anxiety, fatigue, insomnia. Yeah, that sounds really like an oxymoron, fatigue and insomnia, but like yesterday I was trying to have a nap because I felt so tired. I just closed my eyes and I just couldn't sleep. For 2 hours I laid there like that, I just could not sleep, but I felt like I needed to. It was really annoying. Night sweats, yeah, I didn't actually know this was a actual symptom. I thought I just had it because I had the menopause injection, but my menopause injection is worn off now. I'm still getting really hot and then really cold, because that's the next one, feeling cold as well. So I've mixed of like getting really hot and then really cold. Cycle pain, ovulation pain, irregular cycles, irregular bleeding, blood clots, painful sex, infertility, painful with movement in like your digestion system, nausea, vomiting, diarrhea, constipation. Yeah, I've spoken about these ones. Frequent urinary pain. That, yeah, you can have pain while you're trying to go as well, like the pushing pain. Chest pain. Now this one, I've mentioned it before to my doctors, but they just sort of dismissed it. When I was like about 10, before I actually started any periods or anything, I used to have really bad chest pain. I was just always told it's growing pain, but now it's making me think there is a part of this. You can have endo grow on your diaphragm, which can cause then chest pain. My diaphragm was fine though, thank goodness. But something to look for as well. It's weird when you see all these links, like this is from an actual, you know, sciencey person that knows what they're talking about, clearly not me, but it's interesting to see all the links, like you see that and you think, oh, that makes sense. Shortness of breath, rapid heartbeat, shoulder pain, I'm not going to attempt to read that, everyone. Abdominal pain, obviously, pain lying down, dizziness. Now dizziness, no one really mentions that a lot, but I feel like some days I wake up and I'm just, obviously with the brain fog as well, feel like you're in another world as it is, but the room will be spinning like I've had like 10 margaritas. I wish. So yeah, that's another one that maybe they need to think of. They do talk about collapsed lung there, but obviously that's if your endo grows on your lungs, I'd imagine. And if you have endo on your lungs, you can cough up blood as well. So obviously these symptoms in themselves, definitely go to the hospital. Like, don't even question it, chest pain or stuff like that. Make sure you see someone about it. But if you've been looked into, like I've had so many ECGs, I have been checked for everything like that, because obviously it's very serious. But if you haven't got any answers for that and you do have endo, it could be linked to that. Sciatic pain, so lower back pain, that's something I really suffered with before my op. It'd shoot all around from my back, like down my legs. I'd have shooting pains all around my hips. You'd have pain in your legs. This one, which is quite interesting, which I didn't know, with your immune system, you can have seasonal allergies. So something to look forward to know. I used to have hay fever, but not really now. So that must be not. It's not like a bingo game, you know. You don't get all the symptoms, but if some things are not making sense, then this might be something to look into. Food intolerance. Now that's a big thing with endo. It's more so. I'm going to do another video about this as well. There is something called the endo diet, because I can never say this word either. Inflammatory foods can obviously inflame you and make the pain worse. Doesn't necessarily make the endo grow from things you eat, unless they have like hormones in them, which obviously some things you've got to watch have got hormones in. But there's nothing that can make the pain worse because it's growing. It's making the pain worse because it's aggravating. So things like onions and garlic I can't have because it puts my tummy in a lot of pain. That could be as well because IBS it's not well, it's a horrible condition, mix. But there's IBS goes with endo, so I do have the two of those, so that could be why. That's something to look to as well. If you're having a lot of pain after eating, maybe have a look into what you're eating. They recommend doing food diaries, just seeing what different foods hurt, basically. But yeah, I will do another video on that. And then they have down here, which is very interesting because I didn't know this either, nutrient deficiencies. So like low blood sugar, low magnesium and low iron. Obviously low iron I can understand because some girls do struggle with anemia, just due to how much blood they're losing sometimes when they're on their periods. So if you're having any of these symptoms, obviously get checked out by the doctors, especially the more serious ones. Like, please don't sit on it, like see a doctor or go to A&E, whatever you've got to do. But like for me now, I've been looked into for all these chest pain situations and there's nothing to worry about. So I'm starting to think it must be, it does seem to happen when my tummy's flaring up, my chest flares up. So it does just seem to be linked to that. So next I'm going to put up a picture of the classification systems, because when I was woken up from my surgery, I was told, oh, your endo was really minimal. And that was, I found out later then, that was the stage I was at. And then it does make you feel, what's the word? A bit dramatic maybe, because I was like having so much pain, and then you just come back and it's like, oh, it's minimal. But it's not, that's not, it doesn't mean anything basically. So as you can see in the first picture, stage minimal is stage 1. So there's some adhesions pulling, like the stringy bits, and then there's the implants, the little dots. So it can be widespread or it can be isolated to one area, but it just means it's superficial, so it doesn't penetrate deeply into the surface of any organs. And it can also be called mild, and that's stages 1 to 2. Yeah, stages 1 to 2, mild and minimum, minimal and mild, sorry. And obviously mild just got a few more implants, but it's not deeply penetrating into any organs or abdomen walls or anything like that. And it's in, yeah, like I said, isolated areas, or it can be widespread across your body. And then we have stage 3 and 4, which is moderate and severe. So this is deep disease basically. So it's deeper lesions. It can be isolated or widespread. Could involve the ovaries forming cysts or endometriomas, which is the chocolate cysts. Disgusting. Makes me feel sick every time I have to say it. And it can also penetrate organs such as the bladder and bowel. So with superficial, so like minimal and mild endo, if you have an MRI, it won't be seen. Well, it can be, but it's very likely that it won't be seen because it's just superficial on the top of the organs. But if you have moderate or severe, well, that severe is making me, ooh, lots of adhesions on there. Yeah, if you have moderate or severe endo, then that would probably be shown on MRI because it's a lot deeper, so it's gone sort of through a bit of the organ, I assume. Yeah, so none of the classifications actually describe the extent of the pain that you're going through. It does sort of, it does make you feel minimized, to be honest. Like when I was woken up and I said, oh, and they said, oh, it's minimal. It didn't feel minimal, especially all the like it was in a lot of places. But it doesn't mean your pain's any less. Like a girl can literally have the tiniest amount and be in so much pain, or you can be absolutely covered and only know that you have endo because you've tried to get pregnant and you can't, and have no pain at all, and you can be at like stage 4. It doesn't really make a lot of sense. I know it's really confusing, but I just want people to know, like, I did feel rubbish about it, don't get me wrong, when I woke up, but don't let it minimise your thoughts of, oh, was I really in that much pain? Yeah, you probably were. Like, don't let anyone put you down on that just because your stage is minimal. Like, the stages don't mean anything. Yeah, so like the deep disease can occasionally be silent and symptomless. The superficial disease can be debilitating. Debilitating, my God. I can't talk today. I don't know what my excuse is. I'm just going to blame painkillers. There we go. Yeah, and obviously vice versa. But there is no definitive cause, to be honest, of endo. There just isn't. They've tried to look into some things. Like, it could be genetic. So, like, if your mum has it, you're more likely to get it. My concern is now, if I ever have children, I have a daughter, will I likely pass it on? Probably. Which is really rubbish, and I really hope not. But just when those things got to face reality. And there's something called Symptoms theory, which is like retrograde menstruation. That has been mentioned a lot. Whenever I read it, I've been told that that's not true, but it is in the Endo book. That is a potential theory. So I will read it, but don't take much notice of it because I don't really know. I'll summarise it quick. Basically, retrograde menstruation is like with some of the blood in the cells that are shed from the womb lining during a period, pass backwards up through the fallopian tubes and into the pelvis and stick to the pelvic wall. So basically, I was told it was like, instead of bleeding out, you bleed in. Bit grit in my nose, sorry. Yeah, and it just sticks inside you. Yeah, we know that nearly 90% of women experience retrograde menstruation, but it doesn't, so apparently it is a thing, like it does happen, retrograde menstruation, but it doesn't always mean you get endo. So that's why I'm a bit like, I don't get it, like, is this real? So yeah, that theory I'm not too sure about, because there's still a lot of research going into that. Yes, retrograde menstruation is a thing, but it doesn't always necessarily mean you will get endo from it. So they are still looking into that as a theory of a cause of endo. There is also the newborn menstruation hypothesis, which is endometriosis cells have been found in fetuses. So it's basically saying like you're born with it. Yeah, so to try and basically summarise all the book of what it's saying, it says endometriosis has been found in a newborn baby, possibly due to plugging of the womb at the level of the cervix, the womb outlet, leading to a backwards or retrograde flux of the blood and the cells contained in menstrual debris. These findings are causing researchers to speculate that endometriosis, especially in children and young adolescents, could originate from retrograde bleeding soon after birth. So obviously that's still something that are still looking into, and there's lots of other hypotheses that could be like a immune system problem. Yeah, basically they don't know. They put all these things in to sound like all cool, but when they say it, they really sorry, I thought there was something helpful, it's not. They just basically say there is no definitive cause of what causes it, basically. They don't really know what causes it. So there's no way you can sort, like, obviously some things you're like, oh, well, I can stop doing this to make that go away. There's none of that. You either have it or you don't, I think, basically. There's not a lot else you can do. Sorry, that sounds really like doom and gloom, but it's just one of those things, like there's nothing you can do to stop it, so there's no like point stressing over, or is my lifestyle causing it? So they don't really know the cause at all. So just keep, my one thing of this video is just keep an eye out for these symptoms. If you are experiencing any, please see a doctor, especially the more serious ones. Like I know a lot of them were like quite serious. I don't want anyone just dismiss it and say, oh, it's endo. Like please go to the hospital, see a doctor. But yeah, definitely if you've got a couple of these symptoms, just keep being seen, advocate for yourself. That's going to be another video I'm going to do, how to advocate for yourself. It's really rubbish in like, what, 2022, we shouldn't have to learn how to advocate for ourselves, but you do still need that, because unless you have a good doctor or a good specialist, like now, thank God I've got a specialist that I do trust, you haven't got anyone that's really looking out for you. Like me and my friends, we were talking about how there's so many people in the healthcare system we've had to deal with that don't want to help, and I don't know why people would go into the healthcare system where you're there to help people get better, and how they treat you just really doesn't mirror that. So yeah, if your doctor is not listening to you, get another doctor, get a second opinion, see a specialist. I know it can be expensive to go private. Sometimes it might be worth just to have a consultation private, just to get the ball rolling a little bit, get someone to listen to you. And also, I found when I finally went to see a consultant that actually listened to me, shout out to no, I'm joking. Yeah, when I saw a consultant that actually decided to listen to me, it does just really put your mind at peace. Like, you know, you're not going crazy. There's some, like, they'll say, you know, your symptoms are pointing to that, let's look into that. Obviously, I know they can't do all other rubbish tests, and like, even though I did have a consultant I trusted, they still send you here, there and everywhere. It's like they want to test absolutely everything before they get to the diagnosis of endo, especially like my lab the first time didn't show anything. Because I was actually told if there was nothing shown in this laparoscopy, I won't say what, don't mean, but a person to tell me like, oh, you'll have to go to like cognitive behavioural therapy if there's nothing found in this lap, which is just crazy. Like, it's not a brain issue. Like, I've been told quite a lot, oh, like, your brain can make up pain. Like, the stuff you're told, honestly. But that's going to be a whole nother video, I think. So yeah, just from this video, please, if you have any of these symptoms, go see a doctor, push it, don't give up, basically. Keep advocating for yourself. Thank you everyone for watching. Please comment, subscribe. Sorry, this video's a bit everywhere. My brain's a bit everywhere today. Migraine is making the brain fog worse, I think. So I think I'm just going to take myself to bed. Yeah, but thanks for watching. I'll see you all soon on the next one.